Well, for the latest on the India coronavirus pandemic, we're now joined via Zoom by Professor Rajib Dasgupta, who's a professor in community health at the Centre of Social Medicine and Community Health School of Social Science at the Jawaharlal Nehru University in India. Thank you very much indeed. Always good to talk to you. Thanks for your time.
Hello and good evening to you, Peter.
All right. Before we get into the scope of this conversation, perhaps you can just give us an update on what is the situation in India. I know that in May, people were dying literally in the queues to get into hospitals, and they were having ventilators brought to their cars outside. Where are we now, a couple of months later?
Yes, a couple of months later, some of that memory still remains. However, as we speak, the condition across the country is a lot better, barring a handful of states. So in terms of test positivity rate, taking 10 as the danger mark, only one among the large states, Kerala, is 10 plus. The other 3 or 4 states that have a positivity rate above 10 are relatively states with smaller populations. So therefore, as a whole, the country is in a much better position today in terms of daily cases, deaths, compared to the last time that we spoke. But yes, as your report indicated, a whole lot of analysis is going on, and we are continuing to learn more about the second wave that did leave a range of issues and memories behind.
All right, so let's talk about some of this analysis now, because the suggestion is that these numbers have been horribly understated. How much of that do you think is realistic?
Well, there have been alternative estimates. By alternative, I mean compared to the figures that have been published by the state as well as the national governments, all of which indicate undercount to varying extents. Now, at one level, that's understandable given that this is a pandemic. All countries face undercounts to various extent. At the same time, these estimates do continue to conduct analysis of these kinds in order to be able to come closer to what possibly could have happened. Now, many estimates put these undercounts variably over 3, 5, or even 10 times, as one of the most recent ones that your report talked of indicate. There are also independent data scientists who are comparing some of the 2020 first wave data compared to what's known as the compulsory registration system death data, which is available for 2019. And considering that the second wave may have actually had a higher mortality than the first wave, some of this is certainly true. The extent to which these are closer to reality would continue to be a matter of debate, because after all, these are not directly notified deaths, but estimates that are drawn on very established analytical methods.
Brahma Mukherjee, who's an epidemiologist at the University of Michigan in the United States, calls this a complete massacre of data. Is it because it is impossible to collect the data, or, as some people might suspect, is that the authorities are trying not to tell the whole story for whatever reason?
Well, this is a very layered story, as would be the case with almost any other country in this pandemic situation. One of the early starting points of this is, as the WHO document puts it, what counts as a COVID death? And that's where the story begins. Now, in April 2020, early enough last year, the WHO had published an advisory detailing what would count as a COVID death, how to count it, how to report it, and so on. And that was pretty well known to all the member states and ought to have been followed. And there should have been far less room for communication, but this may be more difficult than it may seem. And therefore, all countries have experienced some degree of undercount. As far as the Indian states go, what we know certainly is over the last couple of months, at least half a dozen high courts have intervened on this issue, and many states have actually brought out revised figures which show that the actual mortality, even reported by the same state governments, were indeed higher than was reported earlier. And finally, as I said, that this is a job of data scientists, of epidemiologists, to continue making these corrections based on very well-established figures. And the reason I am highlighting all of this is to also underscore the point that these undercounts are not necessarily conscious decisions by the state, but some of this is also inadvertent given the enormity of the situation. And finally, in contexts where community transmission is so high, given by, at least now proven by the sero surveys, plus actual notified cases, and all kinds of ground reports that we had, what the WHO advises, particularly in these wave kind of conditions, is to have weekly periodic survey of mortality, recognizing very well that formal notification of deaths can be a casualty in these situations.
All right, that was my next question actually about notifications. We know that cremation is very much a part of the cultural landscape in India. Is it possible that somebody could die and is cremated and there's never a real autopsy done or a reason of death recorded?
Yes, death certification, or what's called the medical cause of certifying the medical cause of death. These rates certainly vary over the states, and some of the analysis coming from states which actually have some of the very high levels of medical certification of death and notifying the causes of death. Those analysis from those states, including drawing upon cremation and burial figures, also often point to a much higher level than actually than government figures actually indicate.
I'm also being told that it could be also partly there's a stigma or a shame associated with having died of COVID in the family, and that people are trying to hide it.
Well, that can't be ruled out, but that doesn't seem to have been the case, at least as far as ground media reports concerned. However, what's certainly true is that in rural areas, it's very likely that deaths could have been missed, and therefore the necessity of conducting periodic community-based mortality assessments that the WHO highlights in a very specific context of high levels of community transmission.
All right. I suppose that anecdotally, simple measures like hospitalizations, the level, the rate, will give us an indication. And also, if usually 20,000 people die a day, and all of a sudden now we've got 30,000, one could think that the difference probably is as a result of COVID-19.
By and large, yes, but there would also be some excess mortality on account of other preventable causes, let's say heart disease or cerebral stroke or maternal deaths. And therefore, the more sensitive analysis will also capture a reasonable estimate of non-COVID deaths, which would also have undergone some increase, obviously because the health service system is grossly overwhelmed, and many of the preventable causes would also translate into deaths. That's also a component, but the major component would certainly be contributed by COVID.
And then, of course, on top of all of this is testing levels have never been tremendously high. So the rate of infection, again, is something that we will never really know and understand. And this possibly will explain the undercount for the deaths.
Yes, as the recently released a Sero survey, which is yesterday evening or earlier today, depending on which part of the world you are, this fourth round actually shows that the infection has been highly prevalent, and therefore the antibody responses to that are now among a far higher proportion of the population than was evident in the earlier rounds.
All right, and what's your feeling about where India is going to be going next? Things are better, it looks like. Do you think that the worst is behind? There is no massive fear as the vaccination programs roll out that you'll have another significant wave, or will it be more manageable, the next one?
Well, on a more optimistic note, it will certainly be more manageable than the earlier waves, for the simple reason that a lot less people are now vulnerable, and therefore the count of those contracting the disease would be less. And secondly, health systems have certainly strengthened over weeks and months, and all states are now in a much better state of preparedness. So that's on the positive side. On the worrying side, as your report also indicated, that in the aggregate, at least 400 million Indians still remain vulnerable, given that that's the proportion of seronegative in this latest survey. And this survey is across 70 districts in 21 states. So while it's nationally representative, it does not really let us know by its very methodology of which districts statewise are actually a lot more vulnerable. And therefore, district-wide sero surveys actually offer better insights on that. But just to give you one example, the sero survey results in this round, a metropolis called Chandigarh, which is about 250 kilometers from New Delhi. In this city, 80% overall is what's found to be seropositive, and as high as 71% of children and adolescents in the 6 to 18 age group are positive, a group that almost as a rule stayed home for most parts of the last 1.5 years now, and therefore what this shows is that the levels, at least in the urban areas, are in the range of 80%. So much of this 400 million vulnerable are likely to be more in rural areas, and therefore the worry and the concern and the focus should be on strengthening both primary as well as hospital care services in rural areas, increasingly in the coming months.
Professor Rajib Dasgupta, that's where we'll leave it. Thank you so much indeed for joining us. Your insights always greatly appreciated.
Thank you, and good night from New Delhi.
Thank you.